Knock, knock. Hi, my name is Lindsay Keating. I'm with the University of South Alabama's College of Nursing, and I'm here to do your musculoskeletal assessment today, if that's okay. Are you having any pain or tenderness today? Okay, so the first thing I'm going to look at is your knees, and I see that they are slightly tan. I do not note for any, I don't see any cyanosis or pallor or any redness. And I do not see any bruising or masses or deformities as well either. So I'm going to palpate and you just let me know of any pain or tenderness. Okay, I do not feel for any masses or deformities, and your temperature is equal bilaterally. You have any pain or tenderness? Okay, great. So now I'm going to test your muscle strength on your upper extremities and your lower extremities. So can I have you go like this for me? I'm going to push against you and you push towards me. And now pull towards you. Okay, great. So I'm going to do the same thing on your lower extremities. I'm going to push against you, push towards me, pull towards you. Great. So your muscle strength is a 5 out of 5 on your upper extremities and your lower extremities. So now we're going to move on to your range of motion. So can I have you stand up for me? And I'm going to note to see if I see any discrepancies. So the first thing we're going to do is your temporomandibular joint. So I'm going to have you open your mouth, close your mouth, protrude it, side to side, lateral. Okay, great. So now I'm going to move on to your cervical spine. So can I have you flex, which you put your chin to your chest, okay, up, which is extend, and back, hyperextend. And so now I can have you do lateral, which is ear to your shoulder, side to side, to the other side. Great. So now we're going to do rotation. So look this way and look the other way. Okay, great. So now we're going to move on to your shoulder. So I can have you flex and extend. All right, and hyperextend. So now we're going to abduct and adduct. And then put your hands behind your back. So this is going to be internal rotation. Okay, and now put your hands behind your head, external rotation. Okay, so now we're going to move on to your elbow. So can I have you flex and extend, and then kind of lock them out, hyperextend. Okay, great. And so now we're going to move on to your wrist. So this is pronation. This is supination. Okay, so can I have you flex, extend, hyperextend. And this is radial deviation and ulnar deviation. Okay, great. So now we're going to move on to those were your wrists. And so now we're going to move on to your fingers. So going to have you flex, extend, hyperextend. Okay, so and then can I have you touch your thumb to every single finger? Okay, and then the base of your spine, or the base, not spine, sorry, the base of your pinky. Okay, great. So now we're going to move on to, so we've done everything bilaterally so far. So now we're going to move on to your hips. So I'm going to have you hold on to something. Probably can hold on to the table. Yeah, there you go. So now we're going to flex, okay, extend, and then hyperextend. Okay, you're going to adduct and adduct. Okay, and then you're going to do internal rotation and external rotation. Okay, great. So now we're gonna move on to your knee, and we're gonna flex, extend, and then kind of lock it out, hyperextend. Okay, great. So now you can stand, come back over here for me if you want to. So now we're gonna move on to your foot. So this is plantar flex, point, and then dorsiflex, kind of flex up, and then this is inversion, and eversion. Okay, great. So now can I have you clench your toes for me and then flex them back out? Yep, perfect. All right, great. So now we're going to move on to your spine. So can I have you touch your toes for me? Okay, great. Now stand back up. That's flex, extend, and then 30 degrees back, which would be hyperextend. All right, and so now we're going to do lateral. So I don't want you to move your hips, but kind of like move side to side. Okay, great. And now don't move your hips this time as well, but turn, so rotation. Okay, great, great. You have full range of full range of movement, and I did not note for any discrepancies. So now can I have you turn around for me? All right, so I'll move your hair. So I see that face the camera. So I see from your neck to your gluteal crest, your spine is in alignment, and I see from your shoulders, your iliac crest, and your scapula, they're all even and symmetrical bilaterally. And I'm going to have you stand to the side. And I see that your convex thoracic curve is normal, is there and it is normal, and that your concave lumbar curve is there and it is normal as well. So now can I have you turn back around for me? And now can I have you bend over slightly for me? And I do not see for any signs of scoliosis, and that her shoulders, her scapula, and her iliac crest are all even and symmetrical bilateral. Now can I have you stand back up for me again? Trying to think if there's anything else that I need to say. And I think that is it. So that completes my musculoskeletal assessment.